All right, everybody, now we will be answering your questions about liposuction.
Am I a good candidate for liposuction?
You are not, because you don't have any fat on you. I'm a good candidate for liposuction. Okay, so answering the questions now that we actually have. To tell if you're a good candidate for liposuction, I'd have to see you. We'd have to measure how much fat. Honestly, if you have fat there, we can liposuck it out. If it's a lot of fat, if we get more than 4 liters, then I would say we'll do it in 2-3 stages. So the other thing is excess skin that we have to look at. So there's a lot of different variables that you gotta look at to make sure to see if you are a good candidate. And that's why we have consultations. So book in a free consultation. See, I'm promoting myself now. Book in a free consultation with me and I can tell you if you're a good candidate.
What kind of results should I expect?
Good results, because I'm the best. But the results that we're looking for basically are to have a smooth, tight result in the skin without that lumpy mess. Also, what we want is to decrease the amount of fat and adipose tissue in the area. So if we're doing the abdomen, we want to get you flat abs. Obviously, we can get you a 6-pack if you have the musculature below it, but I mean, it's possible. But I would say that the main goal is just to get, a flat abdomen.
What kind of anesthesia will be used?
I like to use tumescence, topical anesthesia. And what we do with that, how I do it, is my own mix that I've worked through the last couple of years and everything. I've actually tested it on myself, so I know it works. And all my patients, basically, when they come in and they get everything done, they don't feel any pain at all. It's a fluid that has in different types of anesthetic. Some of the anesthetic is long lasting, some of it is short lasting and just quicker. And then I have in some adrenaline and some bicarbonate and different things that I need to use. Basically, and we put it into the area where the fluid fills up the space, numbs everything up, and gets you ready, and then I suck everything out.
What tools or techniques do you use?
I love to use the Vaser. The Vaser melts the fat, also because it heats up the area. It helps to tighten the skin afterwards. It gives a nice smooth finish. Then I will use, the regular liposuction cannulas. I'll go in with a larger gauge at first, and then go down to the smaller ones, or actually the larger gauge or the smaller ones, whatever. And then I'll go down to the smaller ones, and then we finish it off that way. It gives you a nice smooth finish.
What do I need to do prior to my liposuction surgery?
So prior to liposuction, to get ready for the liposuction, I would say to every patient, start and have a good nutrition. Talk to a nutritionist. And the reason is because after you lose the weight with the liposuction, you want to keep it off. But it's better to start off eating right from before. I'm not saying don't eat anything, do these weird fastings and stuff like that, keto diets. I don't want you going on a diet to try to lose weight because you're coming in to do the liposuction. It's just to be able to control your nutrition for afterwards. The other thing is start a good exercise regime. You're going to be out for 2 weeks anyway. Keep doing your exercise regime up until the point of surgery. And then after surgery, you're going to be out for about 2 weeks, and then you can slowly start up again. If you don't have a good exercise regime, find a good PT to help you get started. These good habits will help you later so you can get the body and look that you want. Other things, obviously, smoking. Decrease it if you are a smoker. If you have already decreased it, try to cut it as much as possible. It's not healthy, it doesn't help. And drinking no alcohol the day before surgery, no caffeine the day of surgery. And the reason is because alcohol thins your blood and caffeine raises your blood pressure. So just be careful of that stuff. Because I like to do everything under local, or most of everything under local, but for liposuction, yes. It's a good idea to get a good breakfast even the day of surgery, eat well, and then that's it. So it's pretty straightforward.
How long will the procedure take?
Procedure, it depends how much we have to take out. So if it's a one area, it could take 30 to 45 minutes. I can do usually an average abdo flanks in about an hour. If you've got like 4 liters of fat that need to come out, it's going to take me about 2 hours. So it's a give or take thing. Like, everybody is different. So
what is the recovery like, and when can I return to work?
So it depends what your work is. Recovery wise, you're gonna be swollen, you're gonna be bruised for about 2 weeks, you're gonna be leaky for a couple of days. So I would say a couple of days minimum, stay home. Try to stay calm, relaxed, and don't do anything that will strain your body for about 2 weeks. After that, I like to get people back into doing things. After the first week, even if it's just liposuction, I always advise to get lymphatic massage, and that really helps get everything smoothened out, helps the body recover a lot quicker. But yeah, after 2 weeks, you're pretty much safe to start doing your things. Now, if you're working in an office, after a couple of days, if you're working from home, after a couple of days, and you're not worried about the swelling and the bruising, I mean, I've had, and I won't say any names, but I've had people return to television within a week after having their liposuction. They're just wearing their liposuction bodysuits under their clothes, and they were fine. So,
how much will this cost, and what payment options are available?
So costs are different for everybody. It depends the area. It depends how much we have to take out, and but I mean, if you're looking for something. It really depends. It really depends on how much we're going to be taking out. And the other thing about the payment options, we have plenty of different payment options that are suited and catered to help you out. We don't want to take anybody and you know, we want to help everybody be able to achieve the best results. So we want to help you be able to pay for them as well. All right, so that's it for Ask Dr. John about liposuction, and I'll see you guys next time.